So in this video we're going to discuss Osgood Schlatter's disease. Now Osgood Schlatter's disease principally affects those going through a growth spurt, and particularly those in adolescence. So we don't generally expect to see this as people get older, into their older teens, and certainly it would be very unusual to see it in an adult. Now generally speaking, Osgood Schlatter's disease is inflammation of the growth plate as the patella tendon inserts onto this little bony outcropping on the tibia called the tibial tuberosity. And so what happens is repeated pulling on the tendon causes a little bit of low-grade inflammation in the bone. And that low-grade inflammation then starts to cause problems in terms of pain, and we get pain then on running, on jumping, and any loading. And it can actually be very, very painful. Now the good news is that over time Osgood Schlatter's disease has been shown to be self-limiting, and that means that eventually most adolescents will grow out of the problem. But that often leads to problems because you don't want to ask a child necessarily to avoid activity for a year or two whilst they're growing out of the problem. So what can be done? Well, it depends. Generally speaking, in clinic, we've had great success in trying to normalize the biomechanics, because often we see that the tibial plateau, the tibial outcropping becomes inflamed because all of the muscles in the front of the quad are not pulling evenly. And so very often, if we can restore the normal biomechanics in the hip and the knee and the ankle, and we can get the inflammation to be reduced, and then we can avoid future flare-ups by giving specific advice to avoid certain activities, generally speaking, there is a scope where patients can do very, very well by actually just avoiding certain tasks whilst actually rebuilding the strength. And the key aspect is to try and avoid causing a flare-up.